It's Breast Cancer Awareness Month, and Baptist Health System wants you to be aware of the symptoms and treatment options. We're learning more today with Dr. Morton Kallenberg, Medical Director of the Baptist Network for Cancer Care. Good afternoon, Doctor.
Good afternoon.
All right, so a lot of folks hear about breast cancer. Tell us, how does it start?
Well, it starts with uncontrolled growth of cells, usually detected with mammography. You see alterations in the appearance of the breast tissue. A mammographer or breast radiologist can pick up on that. Sometimes patients pick up on it themselves with self-breast examinations. And just think about it as cells growing more rapidly than they should, sometimes in an uncontrolled fashion.
And so, what is the best course of breast cancer prevention?
Well, there's both lifestyle improvements as well as adherence to what we call screening guidelines. So we know that patients who are overweight, patients who've had a long-term exposure to outside hormones, or what we call exogenous hormones, things like hormone replacement therapy or oral contraception, should basically talk with their doctor about decreasing that use. We believe that women who've had over 15 years of exposure may be at increased risk. Of course, family history is a concern. That's a risk factor. But we know that if we can improve exercise, weight, diet, there is a link between alcohol consumption and breast cancer. So those are all lifestyle manipulations or lifestyle changes that can improve one's risk.
And finally, doctor, what should you do if you are diagnosed with breast cancer?
So when facing an obvious anxiety-provoking diagnosis like breast cancer, it really does, like many cancers, take a team of individuals, of experts who are in a patient's corner to help them navigate those waters. So the first step when an individual is faced with the diagnosis of breast cancer is seeking out individuals who have dedicated their careers to taking care of patients with cancer. Specifically in breast, there's 3 different types of oncology providers: a surgical oncologist such as myself, a medical oncologist who are experts in talking about hormone blocking therapy, chemotherapies. We have immunotherapy and targeted therapies now, and then a radiation oncologist who treats certain types of breast cancer and certain stages of breast cancer with radiation. In addition, one of the things that the Baptist Health System and the Baptist Network for Cancer Care provides is something that's incredibly important, which is navigation. These are oncology nurses who have dedicated their careers to helping women who are facing a new diagnosis of breast cancer or maybe even a later stage breast cancer, helping to, as the title suggests, navigate the waters for care. So being able to provide a one-stop shop experience where a patient can interface with experts, the navigator, almost like an expert concierge in a hotel, will help take a patient sort of step by step through the continuum of care, get the requisite testing that needs to be done.
Everything, right? Just everything
exactly.
along the way. Yes. Yeah. And that's an incredible asset. Doctor, thank you so much. For more information on Baptist Health System and Breast Cancer Awareness Month, give them a call at 866-961-2448 or visit the website baptisthealthsystem.com/breastcancermonth.